Then their money
Please. Please, I'm begging you, okay?
And are you sending samples to the center tertiary center?
designated lab, that specific lab.
Like this that I was sent to Abuja. But in this last Africa, we have it.
COVID everywhere.
ESH.
What is your HIV/AIDS response also coordinated with? About 18,000 people received.
Over 25,000.
Over 25,000.
25,000.
We see more than the conference. In a situation of COVID outbreak, your board, the SNSC is running this space for us, and the work of the SNSC and SNSC along with NACA and we're able to provide methods to look at today. I can confidently tell you that this is the first in the country. Even the national has done application here we can activate and view all these entities ranging from COVID, Lassa fever, real-time data, COVID, Lassa fever, measles, diphtheria, mPulse, pumping pulse, and all other traffic. And again, we have also bringing immunization component from Edo State Primary Health Agency. Here we can do live update of immunization exercise data. And we're going to experiment that in full from this upcoming HPV vaccination exercise and we are really going to showcase that. We also view there and record live events in this center, which can also be sent across this center.
You need to be linked to it as well. Because I see all the primary, I see basic school here from education. So we should be able to see this data.
Can we go to this? So that is the direct camera that can record. As we are here now, it's recording. It's recording live.
Like I said, what you have but there was an assessment of the key among all of this is support from the provide a bigger space so now we can integrate
Thank you. Thank you. Like I said, I was the manager during EOC manager during COVID. And that's when we then realized the need that we needed to be able to integrate data. We spent months buying airtime. Then I want to people, right? We borrowed. And I find some people. I'm going to bring them back. Because of the need for data. Because without data, you're blind. You don't understand. And we've done quite a lot, as you've seen. One of the things, the biggest achievements for us in the state, as regards healthcare, is health programs. So we have a very active health insurance scheme that has almost 300,000 enrolled states, and our goal is to drive it over. So what that does is just gives people better health system behaviors once they know that they don't have to pay out of pocket. And so it's in a situation where that's why I'm saying we have to move from this monthly mandated what's it called? Vaccinations. What do you do for the kids? We've got to move, and it has to be on a continuous basis. Because if we can record most of our deliveries in our PHCs, then we don't have to wait every month to go and be with you. We can do that right there and have the data to follow. So that's why there's a center like this that just helps us aggregate information and data to drive the reforms in the system. The only thing we need to is we need to ensure that the civil center at the center, at the national level, is up to date. Because we have challenges in updating even COVID numbers, COVID data. We couldn't streamline what was coming out of the fields with what we were doing with what the federal authorities were also capturing.
So this kind of center is also replicated at the NCDC so that will just be a room like this that happens things that also outside. But like you said, with nobody kind of support and buying from all the states. So they're going to be the case. If we're able to have that examples with other states, we're hopeful that we can have that across all the states.
Yes, what we want to do is to seamlessly transfer the data from the field into the schools. So you're not capturing anything manually.
So much of this is built on the infrastructure that we built when we started where that data is being collected in the field, on the ground, required to Washington, So building on that backbone, we're able to join forces in COVID response, and then build into this, where you are really using that incredible success that we've had, very close to HIV, and use that to build out the treatment health system and create a set of emergency operations.
So we should designate one PHC in each local government. I mean, those ones that are linked to fiber to be connected to this, so that your DNSOs and your shows you can feed in all the data from the various branches in the local government, and from there capture this data almost simultaneously. What of Lassa? Because that's we should say? Okay.
Can we come back? Come back.
Good afternoon, the Honorable Commissioner for Health and everyone present. I would like to welcome us to the launch of the new integrated Public Health Emergency Operations Center. Your Excellency, please permit me to invite some of the guests on my list. And I'll start by welcoming the Executive Governor of Edo State, Godwin Nolegase Obaseki. Please, a round of applause for him. And we also have in our midst the U.S. Consular, Williams B. Stevens. Please, a round of applause for him. And we have the Honorable Commissioner for Health, Dr. Samuel Ali. Please, a round of applause. And we have the Country Director, Data File, Otse Ogori. Please, a round of applause. Also, we have the Regional Director, Global Health Supply Chain, Bakbeme Godwin. A round of applause for him, please. We also have the State Coordinator, WHO, Dr. Eyo Nora. Please, a round of applause for her. We have the Permanent Secretary, Edo State Ministry of Health, Dr. Stanley Eyaimia. A round of applause for him, please. We have the Permanent Secretary, Hospitals Management Agency, Dr. Efosa Asien. Please, a round of applause for him. We have the Director General, Edo State Health Insurance Commission, Dr. Rock Ameko. Please, a round of applause for him. We have directors here present, and we have all our partners present. Please, you are all welcome. Please, a round of applause for yourself. Okay, right about now, I would like to welcome the Honorable Commissioner for Health as he takes his welcome address. Please, a round of applause for him.
Good afternoon, everyone. Good afternoon. You're welcome once again, the Consular General, Mr. Williams, Your Excellency, the Governor, with our Chief Host, and then every of our partners that are here. Good afternoon. It's my pleasure for us to be here to this launch of this our integrated public health emergency operations center, the very first one in our country that has been activated. There's no doubt that at the heart of this center is a sophisticated coordination hub that will monitor real-time infectious diseases in real time. And this will enable us to respond swiftly and effectively to any outbreak, minimizing its impact and ensuring the safety of our people. By leveraging on the advanced technology and data analytics, we can track disease patterns, predict potential outbreak, and implement timely interventions. Some have asked that, so what's the difference between this and the emergency services that we just launched like 2-3 months ago? Well, this center should provide emergency public health, which are usually in outbreaks or epidemics. That differs from the normal emergency medical service, which usually does not involve an outbreak or it is not infectious, it's not transmitted. A woman who is pregnant or bleeding will not cause the next neighbor who is also pregnant to be to also start bleeding, right? Or to want to also go into labor. But when you have an outbreak that is contagious and that can spread from one person to the other, then the coordination needs to be different. And that is why this was set up different from what we already have. And I think it's good for us to notice. And like I said earlier, this center is designed to serve as a comprehensive coordination for monitoring and responding to infectious diseases such as Lassa fever. And in fact, within the last few weeks, 31 samples have been tested with 1 new case and 0 mortality recorded. The strategic operation of the EOC has led to case positive reports showing a reduction from 23% to 1% for Lassa fever cases within 12 weeks. So all of these are part of the insight that gather preventive strategies and improve our response capabilities. So we are gathered here to formally commission this integrated emergency operations center. This building will offer integration with various health agencies and departments, just like our governor was saying earlier, ensuring a coordinated and unified response to health emergencies. The center will serve as a NEP center, facilitating real-time communication and data sharing among health professionals and epidemiologists. So, all these tools will, including our surveillance system, data analytic tool, and communication, will help us to detect and respond to health threats more efficiently and accurately. This center will serve, Joe presently serving only in those states, is expected to serve the 6 states in the Joe political zone, the South the political zone, until all those states are also activate or put in place their own integrated public health emergency centers as this. But all of this would not have been possible without the enormous support of our excellent governor, His Excellency Governor Nogbin Bagagase Obaseki. And like someone said, if you are called excellence, you have to be excellent. And our governor has just proved that right once again. So thank you, sir. We are very grateful for your unwavering support and leadership in the health sector. I remember one of my directors, one day she attended one of the meetings with the governor, and after I said, the governor knows so much about health. Look at the way he handles this. I'm surprised. Well, I deliberately do that so that they will know the governor and the kind of governor they are working with. So thank you, sir, for making the health sector one of your priority areas, and we are now seeing the evidence of all your hard work in this regard and the support. And I also want to appreciate the staff of the ministry led by the public health director for very active, on-time, always willing, and always willing to go to the extra mile to ensure that work is done as it should be done. We also cannot forget our able partners, the USAID Data File team for the invaluable support, WHO, Atlant Alliance, and all of you. I'm sorry if I omit your names, not because you are not important. Thank you all for your dedication, hard work, and unwavering support. And together, I believe that we ensure that this center fulfills the mission of safeguarding the health and well-being of our people. Thank you very much.
Thank you very much, sir, for the welcome address. And like the Honorable Commissioner said, he said this facility, thank you. Like the Honorable Commissioner said, he said the facility will specifically address public health emergency outbreaks like Lassa fever, COVID-19, and hopefully by the grace of God, we will not see COVID-19 in this state again. Can I hear an amen? Amen. Exactly. So right about now, I would like to invite the U.S. Consular General, William B. Stevens, for his remarks. Please, a round of applause for him.
Great. Hi. Thank you so much for allowing me to join with you today. I travel all over the country, and every time I do, I try to make an effort to visit the healthcare workers. And I heard many of you introduced as doctor, which I find both intimidating and inspiring. Intimidating because you're so much smarter than I am, but inspiring because you truly were the first line of defense and continue to be in keeping our parents, ourselves, and our children safe and healthy. And one of the things that I'd like to do is just thank you. Thank you for what you do. It's a thankless job. It's a dangerous job, which we all learned during COVID-19. And it's a job that requires incredible courage and commitment. So thank you to all the healthcare workers here today for all that you do. And I include our healthcare administrators and the Honorable Commissioner, and even the Governor in those things. because it's the job of government to take care of its people. And today, I think this is a great symbol of democracy delivering for people, right? Responding to the needs of the citizens and working to make us all a little bit healthier and safer. And we in the United States government are so grateful for the health partnership that we have with Nigeria. For nearly 25 years, through the PEPFAR program, the President's Emergency Plan for AIDS Relief, the United States has worked together with Nigeria to stop the spread of HIV/AIDS in Nigeria and then really get very, very close to, if not at, epidemic control here in Nigeria. And that is only due to the incredible work of our partners like Data Phi, Health Alliance, WHO, and the commissioner here and the team here to combat this disease. So it's something that the U.S. has spent nearly $8 billion, is that what I said? $8.3 billion in Nigeria in 20 years. That's an incredible amount of money. But more importantly, that has built a health infrastructure that has allowed for this type of institution, right? When you set up that response to HIV/AIDS, you set up a response that was doing testing and treatment at PHCs in every single LGA in this state. And those PHCs then were digitizing their data and integrating that data. And that led to an incredibly well-streamed response to one disease that when COVID happened, we quickly morphed to a second and built out the sort of types of centers that allowed you to have real-time data on the testing and the treatment and the case numbers and morning calls with the governor in the command center to do exactly that. And that led to where we are today, where you have an integrated emergency operating center for public health response across the entire state and the entire region. And it's something that I think speaks to the incredible work of Nigeria's partners. It speaks to the incredible work of your healthcare community. I will tell you, I shouldn't say this, but I'm not very diplomatic. I spent the COVID-19 in South Africa, right, where we went through many bad instances of COVID outbreaks. And as I sat there, we watched as HIV/AIDS the sort of the indicators were going down, right? That the COVID response was sort of obliterating their ability to keep people on treatment. The exact opposite happened in Nigeria. The commitment to combating COVID-19 led to a further commitment and integration of our health platform, where our numbers increased. The people that were on treatment, the people staying on treatment, the people being tested, those numbers were going up as you were responding to COVID. And that to me speaks to incredible capacity and commitment among the people of the healthcare system in Nigeria. So thank you, and thank you for allowing us to be here today. Appreciate it.
Thank you very much, sir, for a wonderful remark. So right about now, I will be inviting a visionary leader, a champion of progress, the wait-and-see governor who has continuously worked towards the betterment of our state, and this is His Excellency, the Executive Governor of Edo State, Mr. Godwin Norerase Obasekin.
Thank you very, very much. Let me start first by thanking and appreciating our visiting Consul General and his team from the U.S. Embassy and his colleagues from the affiliated U.S. agencies, particularly USAID. We will not be here today but for their generosity and their commitment to helping us fight the scourge of disease in our country. I also want to appreciate all the partners who have worked on this project. I heard about it, but I did not appreciate and realize that it was this elaborate and comprehensive. I'm really thrilled to see that, to find out that I have amazing partners who have done a great job, and I thank God that I didn't decline your request to be tenants in this building. And ahead of everybody else who's been asking me to come and use this building. Like Commissioner for Health, directors, and all of you health workers in Edo State, who we continue to have our tussles daily, all in the bid to improve health outcomes for our people. I want to thank you and say I really appreciate the work that you're putting here. As has been said by the Commissioner, this public health emergency operating center was an initiative that underscores our sustained efforts as a government to strengthen our institutions as a whole, but in particular our health institutions for real-time emergency and disease management in our state. As I said a couple of weeks ago, we did launch the emergency response centers where we're training emergency responders to deal with emergency situations which they find in their communities. But this is different because, as we've seen from COVID, there could be outbreaks at any point in time. And we've suffered quite a few in Edo State. Plates, monkeypox, we always have Lassa fever here. There's a center for Lassa fever. That's why we have a hospital in Europe. And as we see the emergence of new diseases, with post-public health challenges, we must be ready to respond. I tell you, my baptism of fire was during COVID-19, and you know it was an epicenter for COVID spread because of the level of mobility, in this state. We are right in the middle of what we call the movement triangle in Nigeria, and so we had to deal with the COVID response in a manner that I never believed was possible. So as I said, the public health emergency, this public health emergency operating center is set up to effectively respond and coordinate public health emergencies and to ensure adequate surveillance data on disease conditions, especially those priority diseases which we are tracking in Edo, like measles, Lassa fever, cholera, COVID-19, diphtheria, yellow fever, monkeypox, etc. And other emerging or re-emerging diseases. It also will serve as a hub for public health situational awareness, daily epidemiological intelligence gathering, and risk analysis of emergency events of public health importance, which are needed for decision making. We believe that institutions such as these are critical in preempting and managing crisis, especially that data is readily available to study trends, spot outliers, and prepare for effective response in matters of emergency. We saw this during COVID, and that was what informed our openness and willingness to receive support to set up an institution like this. The COVID-19 pandemic brought to our fore the need to strengthen prompt response to public health emergencies, outbreaks, and other priority diseases of public health importance. The Edo State Public Health Emergency Operations Center was set up in 2020 during COVID after several months of painstaking work by myself, NCDC, USAID, and was declared open by a friend and a very dedicated health worker, the then Director General of NCDC, Dr. Chikwe Ihezukwe. We want to thank him. He's not here today, but I think the work he did during COVID must always be acknowledged, because it's to set the foundation for this institution today. The present Integrated Public Health Emergency Operations Center arose from the need to strengthen event-based surveillance for early case detection and improve response to public health events in general. This upgrade required the installation of state-of-the-art equipment, visualization tools, and dashboard for informed decision-making, which was ably supported by the Edo State government, USAID, and other implementing partners in the state, such as NCDC, NACA, and the WHO. I want to thank the WHO in particular and acknowledge the roles they have played in supporting our local emergency response center. It is worthy to note that the Edo PHEOC is one among few in the country that has been upgraded to address the public health events, integrating disease surveillance and response, routine immunization, and review of all public health data for informed decision making. The Edo State government wishes to express gratitude again to the USAID, Data FI, for the support given to the state over the years in improving the health of Edo residents. However, we believe that through your support, that of Data FI and other implementing partners, we will continue to ensure sustainability of this institution. It is our hope that through your continuous support, the capacity of our healthcare workers will be built to strengthen our healthcare system development and increase service delivery to reduce public health disease outbreaks. This is a priority for us. And just to let you know that we have rebuilt our School of Nursing and we have re-accredited our School of Nursing, and I'll make it bold to say that it's one of the best School of Nursing in Nigeria today. We are also concurrently rebuilding our School of Health Technology and re-accrediting it and placing it where it should really belong in terms of providing healthcare support. Because without properly trained healthcare workers, then everything we're doing today or trying to do will come to naught. We will not be able to sustain institutions like this. So our priority is really building the manpower required, building the capacity required of the people who are going to sustain and work with our healthcare institutions. We have greatly enjoyed your collaboration through your implementing partners, especially Data FI, for your contributions in ensuring the functionality of this PHEOC, which is now being integrated. We pray that through your support, Data IFI will continue to sustain their technical expertise in ensuring smooth running of this PHEOC for continuity. Over the years, we have invested in the upgrade of our health institutions in general, particularly in the rural areas, and equip them with tools to collect and process data that will be helpful for the operations of this primary health emergency operation center, and ensure that we get up-to-date data from rural and hard-to-reach areas, in addition to other networks that may already exist for tracking health behavior and incidents of disease outbreaks. I just told the Commissioner a while ago that because of the investments that Edo State government is making in technology, today we have over 2,000 kilometers of fiber connections, and we're connecting 64 main primary healthcare centers by fiber. Therefore, there is really no reason why we cannot develop systems, handheld devices for our health workers to go into the communities and transmit the data they get from those communities, upload the data from those communities and transmit them almost live to the center. Also, the Edo State Health Insurance Scheme is another initiative that supports the mission of this PHEOC because it provides the needed capital base to support the people's health-seeking behavior, as well as ensuring that they are more amenable to pay for services rendered during health emergencies. The scheme drastically reduces the out-of-pocket expenses in health emergencies, and we are proud that it is being embraced, that this health insurance scheme is being embraced by our people. We expect that the health insurance scheme will also play a huge role in supporting the work that this PHEOC will be doing in Edo State. Finally, I want to appreciate you and your team, Commissioner, team, the USAID, and all our partners who have made this possible, and let you know that the Edo State government is totally and fully committed to the health and health-seeking behavior of its citizens, and to assure you that your investment and partnership will not be in vain. Once again, I want to thank you.
Thank you, Your Excellency, for your commitment to ensuring the safety and well-being of the people of Edo State. Your Excellency, right about now, I would like to invite the Director of Public Health to take us through the demo on the dashboard. Please, a round of applause for him.
Thank you, Your Excellency. Thank you for giving me this permission to share a little demo on the dashboard before us. Before now, like I earlier said, the Public Health Emergency Operation Center was focused on COVID data. But this is the first integrated EOC in Nigeria, even the national are not integrated PHEOC. Here we have live data and data analysis of all priority diseases, ranging from COVID, Lassa fever, HIV, immunization data are all stored in this dashboard. For the purpose of time, I will demonstrate with Lassa fever data, so that His Excellency will see his effort he has put into the control of Lassa fever in the state, what we are. From the start of this epic year to this moment, like Honorable Commissioner have already stated in his speech. This is Edo State. We're having this shaded area as Edo map, and it's showing that because it's only Edo State that have integrated public health emergency center, and it's only Edo State data that can be viewed from this dashboard. No other state in Nigeria have captured. So from here, if it's linked up tomorrow with national, they can view our dashboard right from the above. For this year, 2024, we are going to update this.
This was as of March 2024. These are the samples that were tested so far. We have, as of that March, 157 positive cases from the tested sample, and negative was 734. Then alive was 132. Then we have 22 mortality. It was so painful for us to have mortality in Lassa, and that was why His Excellency, when he took us to Lakwe in February, he gave us a mandate to make sure we bring Lassa to a halt. And we have to come back and see how we can work around it. And today, we are good. And I'll show you that on the chart. This chart is showing where we were in Epic Week 1 in January. And this was where we were in Epic Week 2. That was in January 2. We were able to, with His Excellency magnanimity, he released funds to address Lassa fever in the state. And the state focused with partnership with WHO, focused on deratization to attack the host, which is the rat, that is the major cause of Lassa fever in our community. And we have 3 epic local governments in our state. That is Eastern West, Eastern Northeast, and Eastern West. We are going to see the dashboard, if time permits, that the high volume of Lassa cases and mortality we recorded in the state are from these 3 epic centers. And we have to concentrate more on those centers to see how we can do deratization. Deratization means attacking the host by using baits and other material to eliminate the rats from our environments. And we use the DSNOs and the local government, which is domiciled at the health, the LHA, local government health authority, and in collaboration with the environmental health department and local government, to do a joint effort in approaching that deratization. And when His Excellency released that fund, we were able to utilize it and it dropped to this point. At a point in Epic Week 6, we have an escalated figure, and the Honorable Commissioner have to call you to order and says, before it's happening. We have to extend the deratization. We realize that there are some local government we're now having pocket of cases where we have not extend our response and activity to. We have to extend and expand our cost of management and response to other local governments. With the help of the corporate funding, which was released in February to the state, we were able to engage all health workers across the local government vigorously to address the issue of Lassa fever. And we were able to bring Lassa fever to 1% in March. And most benefit of His Excellency, the very rugged Honorable Commissioner, who does not give me pretty space when there is issue. But he can wake me up 1 a.m., 2 a.m., 3 a.m., and call me to order that I need this. So he said, "Are you sleeping? You are snoring." I said, "No, sir." So I'm happy today having all of you here, and I'm very proud to say that Edo State is leading. Even we are leading national. I know what the journalist used to say. Say, "We are not national. We are Edo State. Don't tell me national." So we are not telling national. We want national to take, step from us. Thank you, President.
Thank you very much, sir, on that beautiful presentation. Your Excellency, permit me to invite the Honorable Commissioner for Health as he takes presentation of award. Please, a round of applause for him.
Thank you. In appreciation of the support of the audit USA identified, I want to present these awards as our recognition of their contribution and support to the public health justice.
Come on, we done here. I think we done here. Okay, yeah. Oh, there's a dot there.
very much for your support. We really appreciate it. And this is a token of our appreciation. I think you should
This
say
way,
something.
this year.
Yeah. No, no.
No, you go ahead, don't worry. You're transparent for me.
Thank you.
Thank you very much. This is a surprise to me. It's a big surprise. First, I want to say thank you to Your Excellency. It's amazing your leadership in Edo State, amazing the work you did in Edo State. And it's actually cascading down to the Honorable Commissioner and also to the DPA, who we have worked very closely with. So I want to say thank you for the leadership and for the work you did in the state. Driving around the state, I see there's evidence of what you do, and it's really encouraging. To a younger person like you, it's really encouraging. Thank you so much, sir. Then I want to say thank you to my founder, who is standing here with me. I asked him to come here so that we'll get the award together because of the support that he has given to Data 5 in implementing the work here in Edo State. And also to say thank you to the Consular General that is here. Thank you very much, Will. It's a pleasure having you here and supporting the work that we do. Also to say thank you to the state team led by the Commissioner for Health, the DPH, and all the partners that are here that we work with together, the US government partners, Heartland Alliance, and we have WHO, Madam Nora, who were in your office the last time I visited, and also to thank the state government in, I met a lot of the DPH, all the directors. I might not be able to name all the directors, but I know we meet them and we engage with them. And also to say thank you to the Data 5 team. Sir, the DPH was saying something about the Honorable Commissioner putting him on the stool. That's the way I do with my team too. And this is a testament of the work that we've done. So I want to say thank you to the team, to the Data 5 team. And to Kester. Kester, where are you? Kester is the state lead. So I want to say thank you very much for the work you do in the state. Kester does brilliant work in the state. I want to say thank you to him. Finally, I think I've thanked everybody.
You have to thank God.
Yes, God. Yes, God. I want to say thank you to God because life, ability, grace to be able to do this. And finally, to also say thank you to His Excellency. Thank you, sir. It's a pleasure, and we look forward to doing more. As you said, it supports us.
Indeed, Edo State is the heartbeat of the nation. Your Excellency, right about now, I would like us to go to the entrance for a group photograph.
Let's go back.
Where are we taking the bus?
It's this way. I'm trying this way.
What? When I broken your stuff.
The outside. I'm sorry. One more shirt.
For the photo.
You are blocking me that way. I don't understand. Can we go back? We need to go back. Let's go back. Back a little bit. Back. But they are much now. Please let's move back. Can we find the second line behind us? Can we find the second line? They don't want to appear. Let's answer.
This way. All smile. Now.
Thank you.
Thank you.